Welcome and thank you for joining us for today's session, COVID Vaccinations for Vulnerable Populations Grants. My name is Phoebe James and I'm a Professional Development Officer with the Hunter New England Central Coast Primary Health Network. I'm joined by my colleagues today, Amanda Martin, who is the Grants Manager for the Hunter New England Central Coast Primary Health Network, and of course, John Bailey, the Executive Manager for Primary Care Improvement with the Hunter New England Central Coast Primary Health Network. Before we begin, I'd like to acknowledge the traditional custodians of the land that I live and work on. For me, it is in Newcastle. It is a Awabakal land. I'd also like to pay my respects to elders past, present, and emerging. A few things about the session today. It's going to be recorded and available for you to view in our education library, along with the presentation slides in a few days' time. As attendees, your camera and microphone are automatically disabled. If you'd like to ask a question, please send them through via the questions box, which you will find located in your control panel. These will be answered at the end of the presentation. An evaluation will come directly to you after the session. Your feedback is extremely important as it enables us to provide future educational sessions. Now, it is my great pleasure to introduce our speakers for today, John Bailey and Amanda Martin.
Thanks, Phoebe. If you could put the slides up, that'd be great. And I'll just point out that we've actually got Mel Collins with us, not Amanda today.
Oh, apologies, John.
That's okay. Welcome everyone, and thanks for joining us today. We would like to make you aware of some grants that we have available for vaccination of vulnerable populations with COVID-19 vaccines. Next slide, thanks, Phoebe. So the overview of the grants program is to support the government's COVID-19 response with some innovative local and short-term COVID vaccination activities and strategies. Just to put in context, short-term means they need to be completed by the 31st of December 2023. So we'll update the slide deck to make note of that. These grants are targeted at, as I've said, some short-term opportunities, and they'll provide activities to increase access to COVID-19 vaccination among vulnerable populations who can't otherwise access or have difficulty accessing vaccine through the existing mechanisms. To support the program, the PHN has opened a grant round for organisations to deliver vaccinations to these populations. Next slide, thanks, Phoebe. Just to give you a little bit of context on the need, the data that's available to us shows that only 9.6% of eligible First Nations adults have taken up their 2023 booster. And in New South Wales, only 19.25% of eligible NDIS participating adults have had their 2023 booster. In the residential aged care sector, it's estimated that about 55% of aged care residents have accessed their 2023 booster. And given the severity of illness in these cohorts, those numbers are of great concern. Thanks. Phoebe, if you can go to the next one. Again, the data shows us that the New South Wales called communities have about 10.9% of people who were born overseas have received their 2023 booster, and communities have 8.3 of these people speak a language other than English have had their booster dose. Despite the need, we don't have statistics on homelessness, but we believe that people who are at risk or experiencing homelessness have significant barriers to accessing COVID-19 vaccinations, and this round of grants will support those groups. The eligible populations include Aboriginal and Torres Strait Islander populations, those at risk of homelessness or experiencing homelessness, people who live in remote or rural communities where there are limited healthcare options for accessing COVID-19 vaccine, people who are living in public or social community housing, those who do not have a Medicare card or are ineligible for Medicare, people with a disability, those living in disability accommodation, the called communities in our region, and aged care workers and disability workers. People who identify as LGBTIQA+, women who are vulnerable by having experienced or experiencing domestic or family violence and potentially living away from their family home, asylum seekers and refugees, people with drug and or alcohol dependencies, older people who are, and including those who are living in residential aged care facilities, and other vulnerable groups as identified as requiring dedicated access support. Thanks, Phoebe. I'm going to hand over to Mel to go through the eligible activities. Thanks, Mel.
Thanks, John. Yeah, so I'm just going to go into a little bit more detail around the actual grant activities themselves. So eligible activities are defined as the following. We're not actually setting a cost per head per vaccine, but cost effectiveness of the grant funding will be a major criteria when we're assessing these applications. So our advice to you is to provide as much detail as you can around the activities and the targeted cohorts to help with your application. So we will be able to fund activities that encourage or support reaching the target cohorts, and this could include things like pop-up clinics, mobile vaccinations, transport, incentives to attend clinics, so meals, those types of things, staff travel, administration and delivery costs that are related to the activity. So overall, these activities need to work towards eliminating barriers for vaccination and or increasing that uptake of vaccination. We can also fund PPE and other related resources that can be included as internal costs, but these should very specifically be related to the new activities, not business as usual. And just on that point, most importantly, activities that will be funded are not just the services you would normally provide. They must remove barriers to vaccination for vulnerable populations. So therefore, they should be, as John said earlier, a short-term targeted initiative. Next slide, please, Phoebe. So what won't be eligible in this grant round? The cost of any COVID vaccines will not be funded through this grant round. It's the actual administration and the setup of the vaccination service that can be funded. Obviously, organisations need to hold appropriate insurances and ABNs. And very importantly, an organisation must demonstrate that they have the capability via qualified staff, contractors or partners to deliver vaccinations. So on that point, partnerships are encouraged. So for example, a community service provider who has strong access into a vulnerable cohort may wish to partner with a health provider who might have the actual expertise in delivering the vaccine. So we really strongly encourage those types of partnerships. Of course, activities must be in our Hunter New England Central Coast PHN region, and they must not be targeting people who reside outside of those regions. Activities that are funded through other sources such as Medicare billing, including the flu vaccinations, are not eligible for funding under this activity. However, we are aware that there will be opportunistic situations where the COVID vaccine has been administered and it makes sense then to administer a flu vaccine after. But the COVID vaccine must be the focus of the activity, and if there's an opportunistic situation, that's okay. And then of course, any activities that don't identify the vulnerable cohorts will be ineligible, and activities that have occurred prior to this grant round being released will not be eligible. Next slide, please, Sophie. So just a little bit about the grants themselves. Funding will be available between $10,000 and $250,000. Now that's obviously a very large range, but we've kept it broad, acknowledging that there might be some very large projects that perhaps could cover our entire region, and out in rural and remote areas, down to small pop-up clinics in neighbourhoods, that type of thing. Again, we encourage partnerships, but there can only be one lead organisation. At this point, we will be closing submissions on the 31st of July. However, due to the urgency of the activities, we'll be doing rolling assessments as applications come in, so we can start to get some projects up and happening in our region. So we do encourage you to submit as soon as possible. Don't wait till the end of July to do that. If you've got a project in mind, please start the process now. Submissions will be entered and managed through our PHN Smarty Grants portal. The link will be on our grants page, and it'll be sent to all attendees. Projects that are over the $20,000 mark will also be required to submit a detailed project plan. Again, I can't emphasize enough around providing as much detail as you can, and that will assist with the assessment process. And all projects will be required to provide a level of reporting on the number of vaccinations delivered, the vulnerable populations targeted, for example. Next slide, please, Sophie. So to be eligible, you'll certainly have to comply with the terms and conditions of the grant, which will be on the Smarty Grants portal. Again, outline a proposed plan of your activities, timelines, and a detailed budget. You'll need to provide the appropriate workers' comp, public liability, all of those sorts of certificates. Also, we'll be assessing on value for money, so we'll need to ensure that we're getting good coverage for the budget that's being requested. And you'll also need to be able to provide evidence of being able to source and deliver the vaccinations. And it will be very helpful if you or a partner can demonstrate experience in delivering programs of a similar nature. Next slide, thanks, Sophie. Yeah, so that's the overview of the grants and the process. I'll throw back to Sophie now to see if we have any questions. Thanks.
Thanks, Mel. Any questions from the portal?
No questions have come through. Obviously, sorry.
Okay, what we might do is we might take questions via the normal grants email address.
Yep.
Mel, you want to just
yeah, sure. That's grants@thepHN.com.au, and also if you go to our the PHN website, there's a dedicated grants page which will have all the information around the grant round, and we endeavour to get back to your questions as quickly as possible. We will also generate, if there are multiple questions, a frequently asked questions document that everyone can access. So, yeah.
All right, so just the key points again. These grants are of a short-term nature. The program needs to be delivered by 31 December. There's a large group of vulnerable populations which we've identified in the slide deck. The slide deck will be available after this webinar. If you are proposing to deliver this program, you need to be able to access the vaccines through your normal vaccine process or the process that one of your partners might be using. So, for example, if you're a community group and you're partnering with a general practice or a pharmacy, then you would be able to access it through those normal vaccine channels. High-level reporting will be required. You're required to meet all of the normal rules around having an ABN, insurances, and your staff will need, the staff delivering the vaccine will need to have completed the relevant vaccine education modules. I think that's probably about it. If there are no questions.
Apologies for all of that, but we did have a question that has come through.
Yep.
How do we record the vaccines given to patients? Is it through air?
Yes, yep. So the PHM will not require patient level details. We will require a count and identification of the vulnerable population to which the person receiving the vaccine belongs. So for example, if it's a person who's homeless, then they'll be identified as belonging to that group, and then the count, where it's delivered, etc. The normal process for recording the batch, etc., is done through air, so through the AIR. Yeah.
Yep. And John, sorry, I did just want to add in regards to sourcing the vaccines. There is further information on the grants page with some links that organisations can look at and explore around ordering the vaccine.
Thanks for that. No other questions, Phoebe?
Not at this time, no.
All right, thanks everyone for attending. We appreciate it. As we've said, the copy of the slide deck will be available after this webinar. And if you have questions, if you can reach out to the team through the normal email address for the grants program. Thanks everyone.
Thank you.
Thanks everyone. Bye.
Bye.